'Cause when you take something, make something, tell like it is. When you wake something, shake something, tell like it is. When you hurt something, burn something, tell like it is. You got to tell it like it is. Yeah. Oh, you got to tell it like it is. Now you gonna feel some way.
In this segment, I'll review some situations in which you may need to write a clinical narrative and what kinds of information to include. Of course, you know the word clinical, but what do we mean by narrative? Yes, that's another favorite English major word, and there is a cumbersome dictionary definition. Any report of connected events, actual or imaginary, presented in a sequence of written or spoken words, or still or moving images. All we really need to know is that a narrative is a story. As shown in the dictionary definition, the story can be actual or imaginary, so that doesn't mean you have to make something up. It does mean that you would present the series of events so that the reader or listener can understand the beginning, middle, and end. A clinical narrative, by extension, is a story about patient care. What's the purpose of a clinical narrative? As with most writing situations, the purpose will vary. Here are a few possibilities. Professional development. You can use a clinical narrative to describe a new approach to a problem using a patient care situation as a case study. For example, a narrative about a new drug may be centered on improving a patient's quality of life or life expectancy. Inspiration. Individuals may use clinical narratives as a way to inspire others to either enter a clinical profession or cope during a difficult day. Morbidity and mortality conferences. These are held to determine why and how a certain patient complication or death occurred. Adverse events in clinical trials. The narrative would explain the patient's condition and what events led up to that event. Safety, near-miss, or patient harm events. This is where a medical error either could have caused or did cause harm. We'll look at each of these in depth. The one thing they have in common is that the information is shared and discussed with professional colleagues to reflect on the profession and analyze a series of events. Let's look first at developing a clinical narrative for professional development. Some examples are your experience with a patient or family. That shows how your intervention made a difference in patient outcomes. An example might be that you educated a young couple on the dangers of co-sleeping with an infant, thus ensuring the child was not accidentally smothered during the night. A clinical experience that was particularly demanding might be used to show others how you coped with stressful situations or multiple demands on your time. This could help others develop skills that would help them function more effectively. A clinical event or situation that you think captures the essence of your discipline. This might help people understand why you chose to enter your profession or why you find it especially inspiring. A clinical situation that you commonly confront in your practice that gave you new insight into your role as a professional clinician. For instance, a pediatrician working in an impoverished area noticed that a condition formerly thought of as genetic was linked to poor sanitation. But regardless of the reason for this kind of narrative, what would you need to include? As always, you need to think about who your readers will be, what they already know, what you want them to know, and what you want them to do with the information. Along with a recognizable sequence of events, you should also include a detailed account of the case, so that your reader can visualize the scenario. That is, even if the reader is unfamiliar with your specific clinical role, he or she should still be able to understand the situation. A discussion of your thoughts, feelings, and actions surrounding the situation, and your description should include the rationale for your actions. In other words, explain what you did and why you did it. Remember that in this type of narrative, you want the reader to be able to relate to you and the situation you were in. For that reason, you will also want to explain what aspects of the situation caused you concern and why it was important to you. You can also include conversations you had with others, such as the patient, his or her family members, and other members of the care team. By contrast, a report for a morbidity and mortality conference is not an appropriate venue for you to inspire your readers. This kind of report is just the facts. These reports are used to review cases where a patient died or had an adverse outcome. For example, suppose a patient was admitted to an intensive care unit, then moved to a regular bed, but was then readmitted to the ICU within 48 hours. In this case, the medical team would review the circumstances and try to find out if they could have predicted this patient would be admitted. In other words, did they miss something? If so, what? And how can they prevent the situation from occurring again? In those instances where a patient died, the patient's entire course of stay in the hospital gets reviewed, from the time he or she first entered until the time of death. The medical team and colleagues will review the entering complaint, course of treatment, and monitoring. Here, the goal is to determine whether the cause of death was preventable, and if so, what should have been done. These kinds of reports are protected from legal discovery. The reason is because the medical team's goal is to prevent errors from happening again and to allow for root cause analysis without trying to place blame and without worrying about potential lawsuits. And because of that, these reports are often written in the passive voice. The focus is more on the process, not who did or did not do something. What would you include in a morbidity and mortality report? The information should place the reader in the situation so he or she has a clear mental picture of the circumstances. However, it's important to remain objective. Only present the facts, not opinions or interpretations of the facts. You should include where the event took place, that is, was it in the ICU, on rounds on a regular floor, etc., the day and the time of day, any special circumstances, such as a higher than normal patient population, an emergency situation, understaffing, etc., and details about the patient but without identifying information. For example, you could report, the patient was an 84-year-old male who was admitted through the ER for chest pains. Consent was obtained from the patient's wife and he was emergently taken to the OR for stent placement. Dr. X was the resident physician on duty. She contacted Dr. Y, the attending physician, who authorized admission to the cardiac ICU at 3 a.m. Here you would make specific statements about what actions were taken, by whom, and when. You can also report the outcome, being specific. It may help to have a colleague who is also involved in the patient's care review the report to ensure you've included all the pertinent details. You could also ask a colleague who is not involved in the case to read your report, and this person can help you ensure it's logical and complete and there are no unanswered questions. Clinical narratives are also written as parts of clinical trials, where a new drug or medical device is being tested for safety and efficacy. Occasionally, a test subject may experience what is called an adverse event, requiring a report. There are 3 general classifications of adverse events: mild, and this is similar to a mild irritation which causes no serious injury or harm. For instance, a patient may have difficulty swallowing a pill that is large or uncoated. Moderate. This is an inconvenience, but does not lead to any lasting or permanent damage. For instance, a patient may develop a headache after taking a trial medication, which goes away after using an over-the-counter pain reliever. Severe. This can lead to incapacity or require longer-term treatment, such as a severe allergic reaction to a medication or a harmful side effect. A serious adverse event is the worst of all. This means that the test subject has died or has suffered harm leading to long-term hospitalization or disability. There have been instances of medications causing birth defects in women who were pregnant or became pregnant while taking a medication. So these are the kinds of serious adverse events that may arise and need to be reported. Much like the morbidity and mortality report, an adverse event report sticks to the facts. In random clinical trials, patients are not identified by name, but they do have an identifying number to track their progress. This number must be included in the report with other factual information. So you would explain the patient's age, gender, clinical condition, what disease is being treated, any relevant medical history, and any other medications the patient was taking either prior to or along with the test drug or device. You would describe the nature, intensity, and outcome of the event, what led up to it, the timing of the study drug administration, any relevant laboratory measures or countermeasures, what happened, what action was taken in relation to the event. You would also need to include post-mortem findings, if applicable, as well as the clinical trial principal investigator or sponsor's opinion on what may have caused this to occur. The last type of report we'll cover here is the near-miss or medical error report. The Institute of Medicine published a landmark report called To Err is Human in 1999. It revealed the extent of both documented medical errors as well as near misses, where a person or group realized the error and corrected it before a patient was harmed. The report's purpose was to raise awareness of how errors could occur, as well as encourage medical teams to review processes, identify root causes, and put safeguards in place to help prevent future errors. And here are a few examples of medical errors. Adult-strength heparin was administered to a neonatal patient, causing the infant's death. A patient had the wrong leg amputated. A nurse placed a do not resuscitate wristband on a patient who had never consented to be a DNR. And a surgical team performed an operation without reviewing the original diagnostic tests or films. Discovering the possible problem and correcting it, thus preventing patient harm, is called a near miss. In this case, the medical staff should take time to review the processes and behaviors leading up to the issue. Many hospitals now have electronic reporting systems for errors and near-miss events. These are much less time-consuming than the old-fashioned paper reports, but their ultimate usefulness depends on the people taking the time to report occurrences clearly and accurately. The report should contain patient-identifying information along with dates of any diagnosis, exactly what happened, and everyone who either witnessed or had direct knowledge of the event. There are even categories which can be included in hospital error and near-miss event reports. They are generally numbered, or rather lettered, between A and E, with A being the least harmful circumstance and E being the most harmful one. So E is an error that may have occurred, that may have caused or did cause a patient's death, which is known as a Sentinel event. And in these instances, the medical staff is going to investigate the entire processes and behaviors to discover the root cause of this issue. Sometimes this requires additional training of staff to ensure these kinds of errors are minimized. Obviously, it's not impossible to omit every single error that could ever possibly occur, but in a Sentinel event, we do seek to educate the staff on how the error happened and hopefully minimize to near zero its risk of ever occurring again. And this was only an overview of the kinds of information you need to provide. You can visit the Agency for Healthcare Research and Quality for more information about patient safety and the kinds of safeguards hospitals implement. If you're interested in reading To Err is Human, you could visit the Institute of Medicine's site. It has been updated somewhat since 1999.